Good afternoon, and thank you for joining us today. This is our first COVID-19 briefing we've had since the broadcast in July. With the recent change in designation from risk level from green to yellow in Cass County, we feel it is important for the people to hear from our local public health professionals, our county's two largest health systems, Sanford and Essentia, as well as our local elected officials who hear your concerns. I would like to begin this briefing by introducing my co-chair on the Red River Valley COVID-19 Task Force, Director of Fargo-Cass Public Health, Desi Fleming.
Thank you, Mayor, and good morning, good afternoon, everyone, I guess. As the Mayor said, it's been a while since we've held a briefing, so the purpose of today is to just give you a sense of where we're at currently with our pandemic response activities and where we sit as a county in relation to COVID-19. Hopefully, after everyone speaks today, you'll have a better understanding of our status as a metro area. I will leave the statistical updates and numbers today to Dr. Carson, who will be speaking shortly. As most of you are aware, under the direction from the governor's office, each county in North Dakota is assessed a risk level, which looks at the metrics of average positivity and active case rates, as well as the amount of testing in those areas. As of September 23rd, Cass County was moved into the yellow or moderate risk category. Because of that, recommendations provided by local public health to businesses, schools, and event planners in order to mitigate risk have changed. Today and throughout the pandemic, there has been some confusing messages and false information in mainstream and social media as to the role and authority of Fargo-Cass Public Health. Let me be very clear. Fargo-Cass Public Health does not approve or deny plans. Plans cannot and will not be decided by Fargo-Cass Public Health. Our primary role, whether it's with schools, businesses, or large gathering events, is to provide guidance and recommendations based on the North Dakota Restart guidelines. Since the beginning of this pandemic, we have talked about the concept of test, trace, and isolate as a public health strategy for slowing the spread of this virus. In other words, having a focused testing strategy and a robust contact tracing effort, followed by consistent isolation and quarantine practices. The testing strategy in Cass County was developed to better identify individuals or groups that have a higher likelihood of exposure and may also have poor health outcomes if infected with COVID-19. Cass County has roughly 23% of the population in North Dakota and is currently averaging 18 to 20% of the weekly tests available in the state. Within the last few weeks, our Red River Valley Task Force has further expanded the testing categories to include those with essential travel requirements, individuals in work environments where social distancing is not possible, healthcare workers, and individuals with a confirmed or potential exposure. These categories are in addition to the original testing matrix that was developed in early May. The state is working as well to acquire more testing resources, so as capacity and access to other testing formats increase, we will be able to further expand our testing matrix within Cass County. Also, the local health systems continue to provide ongoing diagnostic testing for COVID within our metro area. Testing is only valuable if it's combined with a comprehensive contact tracing strategy. In Cass County, we continue to follow all positive cases and close contacts during their isolation and quarantine periods. This allows us to provide education and guidance along with symptom monitoring, encouraging adherence to protocols, and advising testing for close contacts at appropriate intervals. Brenton Niesemeyer, our regional epidemiologist, will speak more on contact tracing in just a few minutes as well. The next step is for positive individuals and close contacts to isolate and quarantine. The rationale behind this process is to quickly identify and isolate those individuals away from others to help slow the spread. The virus does not spread, people spread it. We all recognize that needing to isolate and quarantine may be hardships for many, economically, socially, and logistically. That being said, it is a necessary step that, if not followed, will provide an environment where ongoing exposures continue to allow this virus to thrive. Within the last week, there has been attention surrounding the isolation and quarantine process and an executive order at the state level. I'm not here to offer commentary on those events. My goal is to present a consistent public health message that hasn't changed since the beginning of this pandemic. That message is In order to get control of this pandemic, isolation and quarantine of symptomatic or asymptomatic positive cases and household or close contacts are necessary basic principles we must follow, and we need everyone's help and cooperation to be successful. This is not the time to be non-compliant or complacent. We have been dealing with this pandemic for about 7 months, which for many has felt like an eternity. It's unsettling and exhausting. That being said, this will end at some point. And until then, we each have a role to play to help get through this. We can have a public health strategy that is consistent with an economic one. Wearing a mask in public, washing your hands, keeping that 6 feet for social distancing between yourself and others, avoiding large gatherings. These are the best tools that we have right now. I understand that there are still pervasive thoughts that this virus only impacts a small portion of our population. But the reality is we don't know what the long-term consequences may be. What I do know is personally, I have seen healthy coworkers and friends that have gotten very sick with this virus and have struggled during their course of illness, along with the lingering effects. We need to do our best to protect everyone in the community and assure a safe and healthy environment for all. A wise woman on Twitter once said, "I am tired of being part of a major historical event." I couldn't agree more with the wise woman. And while I too am tired, I'm also really proud of the local effort from my team, our health systems, community and state partners, our North Dakota National Guard support team, and local leadership that continues to uphold and support the message and mission of public health. Thank you.
Thank you, Desi, and thank you for all the people that are working so hard on this. Our next speaker is NDSU's Department of Public Health Professor of Practice, Dr. Paul Carson. Paul?
Good afternoon, and thank you, Mayor. Ty, if you can pull up my slides, please. Desi and the Mayor have asked me to speak on a couple of different issues in this segment, a little bit about our current statistics and where we're at with the epidemic here in Cass County, and then a little bit about where we're at with the science and what we know about masking, and then a brief couple of words on where we're at with the vaccine. So first, on our active cases here in Cass County, you can see this is a graph that shows the absolute numbers of new cases by day. And you can see stretching out now into September and towards the end, we are just about at the same peak we were in the first wave of the infection in late May and early June. The dark gray here represents cases that are not in long-term care, but out in the community, and the red are those cases that are in long-term care. And you can see in the first wave of the epidemic in our area, a lot of the cases were in our long-term care staff and residents. And we've strived very hard to try and keep it out of our long-term care facilities where the most vulnerable people are. But you can see also that as it starts to increase again in the community, it starts to bubble its way back into long-term care. It's very difficult to really completely separate and protect our most vulnerable residents from this virus when it's increasing in substantial numbers in the community, which is really important for all of us to do our part to tamp down the spread so that it doesn't make its way into the people that are at the highest risk. Next slide, please. If you, a lot of people will make the statement, you know, we're doing a lot of testing and that's why we're finding all of these cases. And indeed, in North Dakota, we are doing a lot of testing, and we're doing a lot of testing here in Cass County, and we want to continue doing a lot of testing. That is our way to find cases and stop any spread before it occurs. But the case surges that we're seeing recently are not due to just doing more testing. Our testing numbers have been pretty steady for a while. And the way we know that it's not just due to testing alone is because the percent of the cases that are positive is steadily going up. We had gotten to a low of around 1% back in July. And that was fairly flat through July and August, but it's been steadily going up since then to where we're at about 6 or approaching 6.5% now. And where we were for a little while lower than the rest of the state, we're now kind of pretty well matched with where the state is at. So our percent positivity is also going up. Next slide, please. And then one of the things that's often talked about is wanting to, protect our healthcare resources and our hospitals, and really trying to focus on also decreasing people getting so sick that they land in the hospital, or sadly, if they die of this. And this is the number of new COVID-19 hospital admissions by date. The gray is non-Cass County residents, and the red are Cass County residents. And you can see that at the beginning of the epidemic, most of the hospital admissions were in Cass County residents, where the epidemic was most intense. That has shifted to other parts of the state now. And you can see that we're seeing far more hospitalizations or new admits in the state compared to our early first wave of the epidemic. Not so many of them are Cass County residents, but we should be mindful that many of these people who are admitted to hospitals that are from other parts of the state land in Cass County here, because we have tertiary referral centers that take patients from all over the state. And so frequently these COVID admissions do end up landing in our facilities here in Fargo. Next slide, please. So one of the ways that I think, and I think many think is becoming probably one of the most important tools we have in battling this pandemic is masking. And I've been reminded frequently that at the beginning of all this, public health officials were saying, we're not sure about the need for this amongst the public. And the fact of the matter was, we didn't have great evidence about how to use masks in the public, but we're gaining a lot of new evidence and a lot more science around this. And the evidence keeps coming in a more and more compelling way that masks really do work and help. Next slide, please. I'm just going to share a little bit of that with you here now. So that we have some very compelling examples on, for example, what face coverings accomplish. This was a case of a gentleman who was from Toronto, working in Wuhan, China, and was scheduled to board a plane from Guangzhou to Toronto, a 15-hour flight. And he started to get sick right before he got on that plane. And in fact, he decided to get on anyway, had fever, chills, coughing the entire flight in this very confined space of an airplane cabin at what we usually consider the peak of infectiousness, the onset of illness. And the striking thing here was that there were no transmissions, and he was masked the whole time. And this was after a follow-up of 350 passengers on that plane, 25 who were seated right around him, and none of them acquired infection from him. And the caveat being that he wore that mask the entire time. So kind of a compelling story, especially with these 25 passengers within 6 feet, sitting within 6 feet of him for a 15-hour flight. Next slide, please. And a similar story was when the state of Missouri opened up their lockdown and allowed places like gyms and hair salons and tattoo parlors, et cetera, to start going back into business again. And there was a very compelling case here where two hairdressers who went back to work started to get sick. One of them ended up working 8 days while symptomatic, the other one working 5 days while symptomatic. They eventually got tested and were found to be positive, only after they had exposed 139 of their clients. And just recognize, when you are getting your hair done, you're sort of very up close, you're face-to-face, you're talking, and these two hairdressers were symptomatic for these 5 to 8 days. They followed up with these 139 clients, none of whom developed a transmission or COVID infection. The caveat here again is that both hairdressers and all of their clients were masked the entire time. High risk setting, no transmissions. Next slide, please. And now we're starting to get some really good scientific studies on this. This was a study that was looking at household transmission when somebody is sick and comes back home with the infection. And they looked at households where no transmissions occurred amongst the family members and compared those to households where one or more other family members got sick. And they found that if at least one or more people in that house wore a mask before the person started to display symptoms, there was a 79% reduction in transmission to other household members. That benefit kind of went away once the symptoms started. So if we're just waiting to see when we get sick, we're going to miss that pre-symptomatic or asymptomatic period when you still may be able to shed the virus and where it's so vitally important that we wear a mask. Also of note is that the families that disinfected their homes, their countertops and surfaces with like a chlorine or alcohol wipe also had a 77% reduction in transmission to other household members. Next slide, please. And then finally, we can see this playing out in different policy initiatives. So when outbreaks were surging in the Sun Belt states of Florida and Arizona and California and Texas, the traditional, case finding and contact tracing and quarantine and isolation got overwhelmed. And frankly, their health systems were being very, very stretched. And for example, here in Florida, they started to institute various county mask policies at the city and municipality level. They also did some things in some places like early bar closures and limited gathering sizes. And it was those measures that brought the outbreak under control, and they are still doing fairly well at the present time. And next slide. And actually, Ty, I don't know if you can pull up the video very briefly here before I move on to this one. So one of the things that helps, I think, people visualize this is that if you can look and people ask, what kind of mask should I wear? This was a nice visualization from some engineers at a university that looked at a person wearing no mask, or a 1-layer cloth mask in the upper right, or a 2-layer cloth mask in the lower left, and a medical mask like you can now buy at most stores like Costco or Menards or Lowe's. And here the person is counting to 10, and you can see the respiratory droplets that get emitted just even with something as simple as counting in the upper left. But you can see in the upper right, a 1-layer cloth mask blocks that fairly nicely. In the lower left, a 2-layer cloth mask blocks it almost completely, and the medical mask blocks it completely. And if we kind of zoom ahead to this person coughing, you can see it even a little bit more graphically here. Again, no mask in the upper left, a 1-layer cloth mask in the upper right, a 2-layer cloth mask in the lower left, and a medical mask in the lower right. And you can see that especially that 2-layer and that medical mask blocked the droplets that were emitted from that cough. And then fast forward again to the sneeze. The sneeze is kind of the big kahuna of ejecting respiratory droplets. And here you can see this very, very graphically displayed because it puts out so many droplets at such speed. So the no mask, it emits large volume of droplets. The 1-layer, not so great. The 2-layer, pretty good. And the medical mask, very good. And you can go ahead and stop the video, Ty, and go back to that other slide. So, I've had some folks say to me, look, aren't we just kicking the can down the road with all of this stuff, with this distancing, with, wearing masks and so on? Well, yeah, we want to kick the can down the road because just down the road are vaccines and treatments. And we think a number of them are coming online just down the road. So if you can go to the next slide, please. Just a word about vaccines. Really, when you kind of think about this, given that we presume the whole population is susceptible to this, and we're already at over 200,000 deaths in the United States, over 1 million deaths in the world, our only way out of this is with a vaccine. Next slide. So where are we at with vaccines? A lot of people worry about are concerned about the idea of the speed with which vaccines are being brought online, and even the name about, what really is it that's warp speed about this? What's not warp speed is the safety and efficacy data. So when a vaccine goes through the process of getting approved, it has these exploratory and preclinical stages of testing, which can take years. And then if it all looks good, it goes into clinical trials, what are called phase 1 and phase 2 and phase 3, where you test increasing numbers of people. And if that then looks all good, the drug company will file paperwork with the FDA. And then if that all looks good, you start manufacturing. Where we've been able to do warp speed on this is that exploratory and preclinical phase was already kind of done because we'd had a lot of research already completed with the original SARS virus and with the MERS, or Middle East Respiratory Syndrome, both very, very similar viruses to this one. That allowed that to be almost completely sped up. And so that clinical trials started earlier this year. And now several of the studies are in phase 3, all proceeding according to FDA regulations. And then the other part of it that's been sped up is that instead of waiting to the very end for the FDA to review all of this, they're doing it on a rolling basis, and they're doing it at the same time that the companies are manufacturing the vaccine so that it's ready to go if it proves to be safe and efficacious. No shortcuts are being taken on the human studies that are what we rely on for safety and efficacy data from the Food and Drug Administration. Next slide, please. And so just to finish, where are we at with vaccines? There are a large number of vaccines now in phase 3, kind of in the middle. That's the last phase of human studies. There's actually been a few approved in other countries like Russia and China, although we think they've kind of cut the process shorter than we would do in the United States here. But there are 11 candidates in those last stages of safety and efficacy trials. Next slide. And this is the kind of list of the current ones in phase 3. And I would say the ones on the left are the 3 leading candidates. The AstraZeneca vaccine, the Moderna vaccine, and the Pfizer vaccine. They are all in the last stages of phase 3. They are hitting their enrollment goals, which are anywhere from 30,000 to 45,000 subjects enrolled to test this for the safety and efficacy, and things are looking pretty good. So there's a lot of expectations that one or more of these vaccines are likely to be ready by the end of the year, and presuming that they complete all those studies, that they get the proper amount of time to watch. Usually we say 1 to 2 months after the last subjects are enrolled. If that proves to be safe and efficacious, I hope we all get in line to get our vaccines with this. And then the last slide, please. And this is also just a reminder that we should be all getting our flu shots now or in the very, very near future. We do not want to have, we want to minimize as much as possible the expected combined epidemics of influenza and COVID-19 coming this late fall and winter. And thank you. I'll turn it back to you, Mayor.
Dr. Carson, great information to give us, especially very graphically, the different types of masks that work. Our next speaker is North Dakota Department of Health, epidemiologist Brenton Niesemeyer. Brenton, you're on.
Thank you, Mayor. Good afternoon, everyone, and thank you for having me. I was asked to share a little bit about contact tracing and the challenges that we're facing and what's the steps in contact tracing, a little bit about contact tracing. So just a little insight right now, Cass County has about 552 active cases. So that means that we currently have 552 people that are currently being followed by Cass County contact tracers. With each contact, we average, anywhere from 5 to 10 contacts with each person. So we're following a minimum of like 2,500 to 5,000 to 7,500 contacts just alone at any given point, because, we may release that case, but we're still following their contacts. So, the amount of work our contact tracers are doing is phenomenal. They're not out to get you. Recently it was published, the quarantine and isolation. We do want the cases to isolate for that 10 days from symptom onset or from the test date if you're asymptomatic. And that quarantine is one of the best public health measures that we have to prevent the spread. It is super important that if you came in close contact with the positive case, that you do stay home for 14 days from that last date of exposure. You do avoid going to those congregate settings. You do avoid going to the wedding. You do avoid going to church, the mall, the grocery store, because it is through that we can help stop the spread and we can get back to what we call our new normal that everyone has been talking about. And just other things that you as contacts and you as cases can do to help us is, when the health department calls, take that phone call, answer it, return that phone call. Like I said, we're not out to get you. We're just out to ask some basic information. What we're doing is trying to prevent the spread. And we do that by taking time and doing those interviews. Be truthful about who you've been around. Don't give us, we aren't, like I said, again, we're not out to get you. We just want to talk to them, provide some education, find out if they truly were close contact, and if you were set up in our monitoring process. And the last thing is just be kind. North Dakotans are known for being North Dakota nice or Minnesota nice. You hear that thrown around all the time, but recently we've had a lot more hesitancy and a lot more negativity with our contact tracers. And I think if we get back to being our North Dakota nice and start just being nice to one another, treat your contact tracer or treat the person who may call you as a coworker, as a friend, we could get through this a lot easier. And, we're here to answer your questions as well. So take the time to ask the questions to your contact tracer when they do reach out. And I think that is all I have. Thank you, Mayor.
Thank you very much, Brenton. Yeah, be nice to those contact tracers because it is difficult. They're just trying to help out as well. Our next speaker is from Clay County Public Health, Kathy McKay. I know Jim Haney is on. He has given his time to Kathy to speak today and what's going on in Minnesota.
Thank you, Mayor Mahoney. I'll just provide a little bit of update on the current numbers that we are seeing in Minnesota. Currently, right now, there are over 99,000 cases, although 89,390 of those no longer need isolation. We are seeing Minnesota total deaths related to COVID at 2,036. So the Minnesota 7-day positivity rate, it was 5.3 as of the 28th, which was up from the 4.4% rate according to Minnesota Department of Health. So we're seeing the cases rise a bit. In Clay County, our average active cases are between 170 and 200 cases. And we have a total of 1,457 to date. There are 41 deaths. We just most recently had a death in a 90-year-old female. And we've also seen increases in the COVID cases this month. Outbreaks seem to be occurring in social gatherings and workplaces around Minnesota. The transmission is often where people are not following social distancing and the masking guidance. And so we're seeing an increase in that. We're also seeing an increase in the age range from 18 to 22 this past month. So that's been the highest increase in age groups. We're working with our K-12 schools, and we're providing them some weekly data to help them plan for their school modeling. We have a 14-day case rate now that is 42.36. So that's a case rate of that the Minnesota Department of Health is recommending for distance learning for the middle and high school students. They would certainly consider other factors in making those decisions, but that's one of the data figures that they use. So a couple of the schools in our county are still doing in-person learning, and the others are a combination of both the hybrid and the distance learning. We're also working with our higher ed campuses. They're working with Minnesota Department of Health and the local public health to help work through the helping to determine limit the spread in their campuses. Most of those cases are also ones that are being seen because of social gatherings outside of the classrooms. Minnesota is now tested 2 million lab tests, or they've completed that 2 million ratio, and that they're continuing to increase testing in the community as well. We currently have a community testing event at the Moorhead National Guard Armory that started yesterday. It's for anyone in the community that would like to come and be tested, and they will run through Thursday. It's from 12 to 6 p.m., and it's supported by the Minnesota Department of Health, the National Guard, and Clay County Public Health. Registration is encouraged, and so our website lists the information for registering. There's also a phone number for people to call, but they also will be taking walk-ins. Yesterday, they did about 510 tests. Now, this is only the second community test that we have had in Clay County since the end of May. There was one Memorial Day weekend at the National Guard Armory as well. Their future testing plans in Minnesota will be the saliva testing that will start in October. but we do have one location in Minnesota in Duluth that is up and running now, and that will be available to double the capacity of the state testing. So they'll be able to test up to 40,000 per day. That saliva testing does add some diversity to the Minnesota platform. It creates a robust testing system if there's a shortage of specific testing supplies. The saliva test is a 99% effective rate, and results are typically within 24 to 48 hours. They're already using some of the saliva testing for teachers and some childcare workers. We are unsure at this point where the other sites will be, but they will be providing 10 sites across the state of Minnesota. They're also seeing hospitalizations for COVID-19 that are increasing in Minnesota. They have these increases in hospitalization rates have not been seen since the beginning of June. So our state health departments are working closely with the hospitals in monitoring their capacity. The uptick in hospitalizations was also reflected in one of the 5 target goals that the state officials are using to evaluate their progress in this pandemic. The state has been trending favorably, but has now seen an increase of COVID hospital admissions. Since the middle of September, it's at 5.6 per 100,000 people per week. So they're going to be managing that as well. One thing I would like to stress, as was mentioned previously, is the importance of getting your influenza or flu shot this year. The season is approaching. Flu shots are readily available through many venues. And so it's very important to think about getting the flu shot now when it is available. It prevents tens of thousands of hospitalizations each year. It will reduce the number of deaths and ICU admissions and the overall stay for hospitalized flu patients. By getting the flu vaccine, you can protect yourself from this illness and also control the spread in the community. As Dr. Carson mentioned, we'll have the virus, influenza virus, but we'll also be we have the COVID virus that we're experiencing now, and yet to have the vaccine available. So it's really important for people to get the flu vaccine when it is available. The phrase COVID fatigue is being used to describe people really being tired of COVID, and Desi mentioned this as well. So we're finding that people are not following guidance as much as they used to. So we're really trying to stress the importance of continuing that guidance. As much as we all are tired of dealing with COVID and the length of time, we still need to stay diligent to protect each other. Practice the social distancing, wear your mask when recommended or required, wash your hands, all of the public health measures that we talk about. We also are, along with Brenton, are doing the case investigation and contact tracing. Minnesota Department of Health is also providing that. And we would really like people to follow the guidance. We also are experiencing where people are not answering their phone when the contact tracers are trying to reach them. And we really want to encourage everyone to, if there is a phone number, Minnesota Department of Health may be calling you if they're following your case, or Clay County Public Health will also be trying to follow you. My public health team is working very diligently along with the Minnesota Department of Health to engage our community, to provide information and prevention and mitigation guidance. So I appreciate everything that everyone is doing, and I appreciate our community response as well. Thank you very much.
Thank you, Kathy. Now we're going to go to our health systems. The first speaker will be Sanford Health VP, Dr. Doug Griffin.
Thank you, Mayor, and nice to see everybody again. So like all the hospitals in the state, we have been recently experiencing some high demand. However, we still have capacity and staff to safely care for those who need us. As mentioned by Dr. Carson, an increasing number of people are coming to Sanford for their care for a variety of needs, including patients with COVID-19 from across several areas in the state. And we're seeing now our current highest level of inpatient COVID-19 patients since May. Some of the increase in our demand is also clearly tied to care that was deferred early in the pandemic and now has become more serious for patients needing more urgent care. There have been significant advances that have been made and that we have been able to take advantage to in treating COVID-19. So at this point in time, less than 15% of our patients need ventilators. And with the addition of more ventilators, we have no concern that we'll have ventilator capacity for those that need it. Our bed capacity fluctuates daily, and we continue to have the space and staff that we need to care for patients, and can flex space throughout the hospital as needed to meet the demand. We've been preparing for patient surges for months and are well equipped to increase the demand, and we're continually evaluating the readiness of our facilities, teams, and supplies, and are keeping up. We're working closely with the healthcare partners across the region to manage capacity and patient flow as needed between facilities, and our focus is on ensuring each patient receives the best care plan for their needs. We're very grateful for our staff who have provided outstanding care throughout the pandemic. They have worked diligently to serve our patients and communities, and we know it has been challenging. We continue to monitor staffing closely, especially those working on the front lines. We're managing through any staffing challenges that may occur. Any patient who comes through our door will be cared for in a safe manner. So for the health and well-being of our communities, it is also important that we all remain diligent and focused on slowing the spread of COVID-19. I certainly echo all of the things that have been said before. We can all do our part to reduce the pressure on the healthcare system by practicing social distancing, wearing a mask, washing hands frequently, avoiding large gatherings, and following the guidance from the CDC. It is also extremely important, as mentioned, to get your flu shot and keep up with your regular preventive care appointments. Get tested if you've been exposed to someone with COVID-19 and to seek care for any medical issues you have. The other issue that I would like to mention on that regard is a number of people may have symptoms that they might attribute to COVID, take advantage of one of the many ways to get tested and are tested negative, but then yet fail to seek care for their condition as it worsens, which might be some other condition, not COVID, that could be treated as an outpatient before it gets worse. It's up to each of us to take responsibility to do our part to stop the spread. And I would also like to point out we do have drive-through flu shot clinics. Those have been a great success. Coming up, the next two are on the 10th and 17th at the Fargo Dome. Last Saturday, we immunized more than 650 people. It's been a big success. Treats for the kids, doggy biscuits. So I'm not sure that we'll ever go away from offering drive-through flu vaccines. I want to thank our frontline healthcare workers, our health system, public health and civic leaders, and everyone who continues to do all they can to keep our community healthy.
Thank you, Dr. Griffin. Essentia Health, Dr. Rich Vetter, how are things going over there?
Great. Good afternoon, Mayor. Good afternoon, everyone. Thank you for allowing us this opportunity to provide an update on the COVID-19 pandemic, as well as some of the activities that we're working on at Essentia Health to improve the health needs of our patients and communities. At Essentia Health Fargo, we have 145 licensed beds. We have been also seeing an increased number of inpatients over the past several weeks, and it's sometimes been near capacity. As of this morning, for example, we had 121 inpatients. Our census though fluctuates on an hourly basis, and our teams are constantly monitoring that volume and managing to it as appropriate. We have internal processes and surge plans in place to respond to our fluctuations in census. These processes involve managing our beds, our staff, our resources, as well as triaging patients as appropriate. The surge to date has not affected our daily operations or our ability to serve our patients. While we've seen an uptick in COVID patients over the past several weeks, though, it's not the sole reason for our increased inpatient volume. Similar to what Dr. Griffin said, we're seeing people who have delayed care and now are needing care for other medical conditions, as well as transfers from other parts of the state. I would also like to stress that we need to do what we can as a community to reduce the transmission of COVID-19 to ensure that we don't overstress our health systems. Dr. Carson discussed that the CDC recommends that all people over age 2 wear cloth masks when out in public settings and when around people who don't live in your household. As we know, this is important because of COVID-19 can be spread by people who don't have symptoms and don't even know that they're infected. Dr. Carson did a great job also kind of emphasizing that more and more clinical studies support these CDC recommendations. And wearing a mask is really the best way to protect your friends, neighbors, loved ones, and sends a strong message of caring for the well-being of others and the health of our community. We've also taken significant steps within our facilities, as we've discussed previously, to reduce the transmission of COVID-19, such as universal masking, practicing excellent hand hygiene, careful cleaning protocols, and limiting visitors to our facilities. Our efforts to protect our patients and colleagues are taken very seriously. We currently do have adequate supplies of our protective equipment as well as testing capabilities. We currently have instituted several different testing platforms to test for COVID-19 infection, and we're also exploring other options, as was mentioned, using saliva testing as an example. Also want to mention that with the upcoming fall and winter season, we are also developing respiratory pathways for patients who are seeking care for their respiratory illness. As Dr. Griffin said, we don't want people ignoring care just because they test negative and they might need to be seen for another reason. Our options for care include our e-visit option online as well as demand or virtual visits. About 15% of our patients continue to receive their care through a virtual platform. We have our nurse care line that can help with triaging, and we also have safe face-to-face visits and designated spaces for our patients as well. I'd also be remiss if I didn't also take the opportunity to just make a pitch for flu shots as well. As many of you know, the flu shot is a safe and inexpensive way to stay healthy. It has been shown, or flu shots have been shown, to reduce the risk of flu illness, hospitalizations, and death. And as was mentioned earlier, can decrease the burden on our health system and make sure that those who need medical care can get medical care. It is possible that you can get coronavirus and influenza at the same time. The symptoms can look very similar, so it's important to be tested. And then again, also considering other diagnostic options if those test negative. Just so again, I want to urge everyone over the age of 6 months to get their annual flu shot, especially those at most risk and those who are caregivers or close contacts for those at high risk. We are encouraging people to get their flu shot if they have an upcoming medical appointment, so they only have one stop in the medical facility, or also attending a special flu event in the community to get your flu shot. It takes about 2 weeks for your body to develop antibodies to the flu vaccine, so would encourage people to do it before flu season starts in the coming weeks. In closing, I also want to take this opportunity to just thank our physicians, providers, nursing, other support staff for their commitment and dedication to our patients and our communities, and all of you as well for all you do every day to keep our community safe. Thank you.
Thank you, Dr. Vetter. As we have heard from our public health professionals and healthcare systems, we need everybody to take this virus seriously. If not for your own health, please consider the health of your friends, family, neighbors, and our community's most vulnerable. You've heard us talk about distancing, hand washing, and disinfecting is key to mitigating infections. I do want to take a moment, however, to talk about masking. We all recognize that until there is a vaccine for COVID-19 virus, it will continue to influence our life. At this current moment, masking is the quickest and simplest way for most people to protect themselves and one another. We'd like to drive the numbers on this virus down over the next 2 weeks, and we have evidence it does work. CDC Director Dr. Robert Redfield states, "We have clear scientific evidence that they work and they are our best defense." Dr. Carson's slides were excellent on that today. Masks are not a substitute for distancing and hand washing. They are, however, strategies that work. Combining these tactics lowers the risk of COVID transmission and protects us all. I understand that masks are not always most comfortable to wear hours on end. I've done it in my life as work, but it's important to recognize and understand that they are effective in protecting people and a critical instrument in reaching a new normal. Masks will be needed to safely resume live events, gatherings, and return to normalcy. I trust the people of the metro area to make the right decision for the health of themselves and those around them. I'm asking, as your mayor, a surgeon, a father, and a husband to a healthcare hero, for you to please wear your mask when you are not socially distanced. Before I introduce the next speaker, I'd also like to announce that the Red River Valley COVID-19 Task Force will be unveiling a masking campaign in harmony with the statewide Mask Up North Dakota campaign in the next few days. The task force has partnered with local athletic teams, local health systems, and everyday people to help promote a better understanding of why masking is so important. More details will be coming. Now I'd like to introduce our next speaker, Westfire Commission President Bernie Dardis, to share his thoughts and update you on what's going on in his city.
Thank you, Mayor Mahoney. I too would like to thank the public health professionals and the major providers within our community for all their guidance and help, and certainly all of their employees that are on the front line working diligently to save the people that are in critical care. What would you do if one of your children, one of your grandchildren was at risk for any type of injury or sickness? What would you do? As a grandfather and as a father, I'd do anything to protect them. So this discussion that we're involved in with regard to this horrible pandemic is one that we have to call on all of you, our healthcare professionals, our public health professionals, the mayor, the Moorhead people across the river, Clay County, Cass County. We're all appealing to you for the same thing. We need to do what we need to do. And that is to protect our loved ones, protect our economy and the businesses that we all enjoy going out and partaking in. The term has been used a lot about COVID fatigue. Believe me, this person sitting here in front of you is as sick of this pandemic as anything. But us being tired of it is not going to resolve the issues that are at hand. We continue to be told to wear a mask, maintain social distancing, wash our hands, and if you don't feel well, don't go out shopping, don't go to work, don't go see loved ones. That's very true. We have a very public debate going on right now with our public school systems. I've had the pleasure of being a guest in all of the planning that has taken place in West Fargo by Superintendent Sleddy, the West Fargo School Board, and all her administrative team. The thought and process, the logistics of what they have dealt with are overwhelming. Yet the public continues to have an active debate about the different models of partial days or hybrids or in-person learning. Ladies and gentlemen, we need to do everything that we possibly can to support our public health officials, our school administrators, and the like. And at the same time, if we are feeling good, and we are wearing our mask, and we are going out in public, support our businesses, because they're as vulnerable from an economic standpoint as everything. West Fargo has made a number of changes since we went to yellow, and I would encourage people to go to westfargond.gov for some of that information, because not all of our offices are open anymore. We have some restrictions, and I won't go into those particular details. So, again, what would you do to protect the loved ones in your life? I'm one of these guys with an underlying condition. But more importantly, I have two daughter-in-laws that are absolutely mama bears. And if Grandpa doesn't wear a mask and Grandpa doesn't social distance, Grandpa won't get to see those 4 beautiful grandsons that I have. So if you see me out in the public, you're going to see me in a mask. You're going to see me washing my hands as I walk into City Hall. You're going to see me at City Hall with a mask on whenever I'm in the corridor. You're going to see me sitting in my office with the door closed, because that's the protocols we have to protect our employees at West Fargo. So ladies and gentlemen, we're asking you for some very simple things, but very, very, very important to the well-being of our communities and for our loved ones. Thank you, Mayor.
Thank you, Mayor Dardis. That's very good analogy. Cass County Chairman Chad Peterson, your thoughts?
Out of a preponderance of caution. When this pandemic first started, I used the phrase, prepare, don't panic, and it must have stuck because it wound up on the video boards behind us for some period of time. I believe in masks. They work. I watched a gentleman online, a gentleman by the name of Ben Shapiro, caught a show regarding this, and he used the phrase, out of a preponderance of caution. He doesn't believe in masks necessarily, doesn't know if they work or don't, but when the pandemic started, his parents moved in with him, and when they did, they made a choice as a family that out of a preponderance of caution, they wear masks when they go outside. The intent is to maximize the survivability of his parents. Because every study they pull up, as we saw earlier, you could probably go online and Bing and Google a story that says they don't work. Here's the struggle, is that this isn't that heavy of a lift. Let's pretend masks don't work. I think they do. I think we all know they do, but let's pretend they don't. If we're wrong, the sacrifice we're asking you to make wearing this double layer piece of cloth is to look silly and be uncomfortable for a period of time while you're out and about. That's it. That's your major sacrifice. If they do work, these magical pieces of cloth, the result could be you could save someone from getting sick. You could save someone's life. Am I exaggerating or embellishing for effect? No, because even though the mortality rates are so low, if that person is your mom, your dad, your brother, your sister, your son or daughter, the mortality rate may as well be 99.9% because you have lost a loved one. I don't think it's that big of a deal to wear a piece of cloth. I just don't. And again, if I'm wrong, the heavy lift is next to nothing. If I'm right, we wind up potentially saving lives. And at the very least, I think, again, as we've said prior as well, we reduce the spread. That can't be a bad thing. So I'm going to stop there, and I'm going to say I'm asking you politely, professionally, out of all due respect, please, if you are I call you a mask atheist, if you are a mask atheist, out of a preponderance of caution, please wear a mask. We will get through this with your help. Thank you.
Thank you, Chad. And from Moorhead City Council, Shelley Carlson is in for Mayor Judd today. Shelley, you're on.
Thank you, Mr. Mayor. Mayor Judd sends his regrets for not being able to attend, but I am happy about the opportunity to come in and be part of this. I just have two quick things to say. I don't want to really echo what anybody else has said. Masks work. The video very visually shows how masks work. I live in a state where our governor has issued a mask mandate for our entire state. So on our side of the river, we're all doing the mask thing. But something that Mayor Dardis said really struck me as, this is something that we're doing to protect our loved ones and our friends and our family, our neighbors, our children. And I don't think that we ever want to live in a state of regret that if one of our loved ones passes away from this virus, that we think about, well, if only I would have worn a mask, could that have prevented it? And because we don't want to Monday night or Monday morning quarterback our responses, our actions towards our loved ones, doing the simple thing, like Commissioner Peterson said, of wearing these kind of silly things, which can really have some good messages, like the one that says, more head, more to love, 56560. We can do those types of things. The second thing that I wanted to just mention was something that Desi talked about the fatigue with COVID. And there was a friend of mine who went to bring a care package to her daughter at NDSU and was struck by how incredibly lonely our college students are, and I thought about how incredibly lonely some of our citizens are in their homes that are having to quarantine or socially isolate because of pre-existing conditions. And I think about that this fatigue is really wearing on them. For those of us who have the ability to go out in public by wearing a mask, it's getting hard for us, but it's incredibly hard for others in situations. And if we could just, each one of us, reach out to 3 people, whether it's a college student writing a note, sending a care package, whether it's somebody in long-term care facilities, sending a card, sending flowers, reaching out through the phone. I know many long-term care facilities now have the ability to do Zoom or whatever platform you're using to be able to see somebody face-to-face. That's going to help isolation and also, I think, help our fatigue with this COVID, because a lot of the fatigue comes from not being able to connect that the way we used to. So I always think about meetings and I always think about action items. So I think the 2 actions are to, wear the mask so we don't have the regrets, and to reach out to combat that COVID fatigue. Thank you, Mr. Mayor.
Thank you for addressing that. I think mental health is really a big part of what's going on. I want to close by thanking everybody who was tuning in and for all our participants in today's briefing. The coming weeks are an incredible important fight against COVID-19. We're back to the numbers we had in May, and we'd like to not go backwards in what we're going to do with people. You still have an opportunity to mitigate the spread of the virus and save lives as you do so. The power is in the hands of the people and their decisions. So remember to distance, wash your hands, and mask up. Thank you.